One of my friends mentioned in a post when talking about healthcare expenses and whatnot is that he hoped that Medicare would be available when he switched from privately funded healthcare to publicly funded Medicare in retirement. That he didn't plan on contributing more into his healthcare than he needed to in retirement. What I explained to him is that the data does show that people who are working age use privately funded healthcare in the form of healthcare that is backed and supported by employers, and they opt into Medicare in retirement. But when I was thinking about that, I was thinking, well, how much can you expect from Medicare in the future? If you are today, maybe you can expect a certain level of care and you can expect Medicare to provide a certain level of benefits. But what about in the future? And how does inflation play a role in this if you're talking about inflation over 20, 30 years, or you're talking about a hyperinflationary scenario? And so this got me thinking, how am I going to build a model that explains this in the context of healthcare expenditures so that we can understand what small differences in the difference of healthcare benefits versus healthcare expenses, and what this difference can mean when it's expounded over many, many years, or when you have a shock in economic terms, or a sovereign debt crisis, or you have a problem where the government cannot pay the benefits and the costs essentially increase at an alarming rate. I did a podcast on this very topic that you can see in the description, and I will link a description to the podcast in Healthcare and Analytics podcast, where I talked about three specific situations. One was in the United States during the pandemic, and Harvard Business Review and McKinsey and Company essentially explained the detrimental cost to healthcare in the pandemic because of shortages and increase of costs during the pandemic. I then go into three specific scenarios where hyperinflation took place. First in Weimar Republic, second in Zimbabwe, and then third in Argentina. Although three very different scenarios, it helps us understand one basic principle, is that the government usually does not provide enough benefits to cover the costs in inflationary environments. And this could be inflationary environments over a long period of time, or it could be hyperinflationary environments where the government is trying to catch up and trying to provide benefits higher and higher and higher, but the costs keep on going even higher than what the government can provide in benefits. So let's get into this model. It's a very interesting model and it's very insightful. Although it is simple in its mechanics, it can explain in depth what happens over time and how the effects of compounding interest can make a big difference. When we're trying to model healthcare inflation, there's a few different ways you can think about it, but in simple terms, one of the ways I wanted to model it was, what's the difference between the healthcare benefits that you're going to receive, let's say from the government in the form of Medicare when you retire, versus your annual healthcare inflation, or the cost of healthcare that goes up over time. And this healthcare cost certainly increases at a certain rate, and the government says, hey, our CPI is XYZ, so we are going to now provide benefits of this amount for Medicare, Medicaid, or any other government benefits. And the government is essentially encouraged, or their incentive is to understate inflation so that their benefits don't increase as fast as inflation actually is. And so there are many different websites you can go to that explain the real rate of inflation versus what is stated in CPI. I won't go into it here, but those specific things are things that occur in inflation on a regular basis. But for this model, we're essentially taking the parameter of the years. What year is it? Is it 2024 to 2030? Are we looking at a longer time frame from 2024 to 2040? What's our time frame? The second thing is, what's our beginning healthcare costs? And so what are our healthcare costs today? So if the average per capita expenditure is around 11,000, then then we can expect the dollar amounts to then be expounded upon in the future based on this initial beginning healthcare costs today on an annual basis. The second and third parameters that we're using is your annual benefits. So how much on an annual basis do your benefits increase? And then also, if you have hyperinflation, what is the amount that is above those benefits that the government will provide? And so in normal inflationary environments, let's say the government would give every person who needs to receive benefits 5% every year. But in a hyperinflationary environment, let's say they have to boost benefits by 50, 60, 70, 80% to keep up with the cost of living. And so the adjustment is just that, an adjustment parameter on top of the normal benefit increase. On the other side of that, you have your healthcare inflation. And so in a normal inflationary environment, what is your healthcare cost going to increase on an annual basis? And then the adjustment upward if you have a hyperinflationary situation. One of the things that I will note is that if you have normal inflation versus hyperinflation, you need to be able to understand when you're in different inflation regimes. And so if you are in a normal inflation regime, then you can expect, okay, this year's inflation is going to be 5%. Next year is going to be, let's say, 5 to 6%, but it could even go down to 4% if there is a disinflationary event, or there's disinflation if interest rates are high, or whatever other economic indicator that you're looking at. And so in a normal inflationary environment, these are your expectations. But once you start to reach an environment where people's expectations are, let's say, more hyperinflationary and it gets dialed up really quickly, then you have a huge disparity over time. And so in the beginning, let's say if we're looking at 2025 to 2030, for example, here, then what you will see is that, okay, in the beginning, your normal benefits would increase just as much as your costs are. But then in 1 year, you're having to, your benefits are increasing by $1,000, but your costs are increasing by that much more. Or your benefits in a normal environment would be one thing, where in a hyperinflationary situation, it would be another. And so if your benefits are increasing normally, then you can increase a normal rate of 5%. But if you have that adjustment upward, then that upward adjustment compounds. And so that's what we're showing in this graph here, is the difference in benefits in a normal inflationary environment versus a hyperinflationary environment. Down below, we're talking about healthcare benefits in normal inflation. And so if you're talking about benefits and costs in normal inflation, then over time, if you have a small difference, then it expounds over time. And so suppose we have benefits that increase at 5.10%, and you have healthcare costs that increase at, let's say, 6%. So you say, okay, that's not that big of a difference. That's 0.9%. That's less than 1% over time. That may not be that big of a difference. And so in 1 year, your difference may be $150. That's not big of a deal. But in, let's say, 5 to 10 years, that difference is $1,000. And then if you expand that outward, let's say 20, 30 years, that difference is such that now you're looking at $40,000 plus for the difference in the benefits increase versus your hyperinflation or even your inflation. And so if normal costs are increasing, let's say 1% more than what the benefits are, then in a short period of time, you're like, well, I don't care. It's $1,000 on my income. That's not a big deal. But if you're planning to retire 20, 30, 40 years down the road, then that makes a big difference because the government won't be able to provide the benefits that they did before because of this normal inflationary environment. The same goes with costs. And so the costs increase in a normal inflationary environment pretty low, but when you have hyperinflation, there's an inflection point where hyperinflation just takes things to another level where it's difficult to cope with, and you have to then readjust your mind and your habits to that kind of activity. And so in in the chart below here, we're trying to explain the same thing, that your healthcare benefits versus your healthcare costs and hyperinflation can be a lot more drastic. And so if you're talking, let's say you're talking, let's say 10 years, then, and your hyperinflation is at, let's say, 80%, you can see that seemingly hyperinflation is way higher if your benefits don't increase. And so usually what will happen in the situations that I have looked at, meaning Argentina, Zimbabwe, and the Weimar Republic, is that it takes the government a few years to catch up to this new inflation regime, and by then it's almost too late, because you have that gap that's expounded over time. And so if you have a gap of, let's say, 30% between what your benefits are and inflation, the next year, even though it's 30%, it's an even bigger gap. And even if it is still that 30%, you still have that gap that's increasing over time. And so this specific model kind of explains that in order to kind of get an idea of normal inflationary environments, but also hyperinflationary environments, and how in hyperinflationary environments, the normal inflationary regime is almost insignificant. Like, you don't even think in terms of normal inflation when things are going through the roof. And in our reading, and in my reading from the Weimar Republic, it was essentially this way, that between 1921 and 1931, in that 10-year span, people's habits and activities, even in healthcare, changed drastically. And so in the early days of inflation in 1919, 1920, 1921, people weren't as desperate. But by the time 1933 came around, people were really desperate and made actions that you would have thought would not be possible 10 years ago. And the reason why is for a manifold reason, and this gap, because it's so exacerbated, it takes things to another level, and people's economic situation changes drastically. Okay, in a normal inflationary environment, it's not that big of a deal, let's say if you're looking at a span of 5 to 10 years. But my friend, like many millennials, are hoping to retire in 20, 25 years, 30 at the most. And so with that time horizon, it's a lot different than those who are retired already today. Today, if they're retired and they can receive essentially 100% coverage of their benefits, then they're not necessarily complaining, because in 5 to 10 years, the amount that they would have to cover in order to meet what they expect to receive in healthcare is not that big of a deal. But over time, it is a big deal, because you don't necessarily expect to have the same kind of care that was provided before, because the benefits don't catch up with the normal rate of inflation. And so this is what we're showing here, that the healthcare benefits versus healthcare costs in normal inflationary environments, again, aren't that very different in the first, let's say, 10 years. And so the difference could be $1,000, $1,500, and even within 15 years, you have a difference of $3,000. But by the time 30, 40 years comes around, if you have a small difference of less than 1%, then you have a bigger gap of $10,000 that you're having to work with. But let's say instead of let's say a 1% difference in the two, let's say it's 2% difference. Well, that provides a lot bigger gap, right? And so what that means is that even though for the first 10 years it's not that big of a deal, now you're having to then fill a gap, and your difference is between them in the first 10 years is $3,000. By 30 years, you have a difference of $30,000. And so even though you have a small discrepancy between the benefits increase and your healthcare increase in costs, a 2% difference over a long period of time is a lot more exacerbated than that 1% difference. And so this is what I will note, is that even if your benefits are increasing year over year, you need to keep track of what those healthcare costs will be, and are they tracking with it closer than not. And if they're not tracking, let's say, within 3%, then you know that you're going to have to cover that when you retire. Another way to look at this is healthcare coverage. And so if you have a 2% difference between your healthcare benefits and the healthcare costs of inflation, then over time your coverage will go down, meaning that the amount that you receive in benefits to the healthcare costs will go down, because in the first few years you're reaching 100%, meaning that whatever benefits you receive from the government, you can then pay in healthcare costs. But if the difference between your benefits and the real costs like branch out, or they vary, then what you will have is you will have a coverage percentage that goes down and down and down over time. And so you can expect in 30 years to have a coverage of 76%, meaning that you're going to have to cover and you're going to have to make up 25% of what you would have otherwise had to make up, because the government cannot make that gap up. And if you're looking at a year-to-year basis, it doesn't make that big of a difference. But when you're looking at a long time horizon, these small percentages can make a huge, huge difference. One way to look at this as well is the cost gap. And so if we have on one side the costs in normal inflation of benefits and healthcare costs that go up, you have this gap that increases over time. And so if the gap is, let's say, very, very small, of $200, $600, $1,000 in the first few years, if you're looking at, let's say, 20 years down the road, your gap is already $10,000. And so you have to expect to, out of the gate in retirement, be able to meet this gap that was there in previous years, because you're entering into a place where the government is now only providing, let's say, 70% of the services, or being able to pay for 70% of the services that in time past they paid 100% for. And so you can look, let's say you're going to retire let's say you were born today and you are going to retire in 2049, okay? Which is 50 years, okay? So that's still really early for retirement, but your gap is $30,000. And so out of the gate, you have to be able to understand that your healthcare coverage is going to be 65% if there is a difference between 2% between the benefits and healthcare over that period of time. And so out of the gate, your retirement, let's say, if those who are born today, their gap is $30,000 that they will have to make up, because the government will not be able to provide all payment for healthcare that is needed. Another way I like to think about this is in terms of government funded versus privately funded healthcare. So if you think about it this way, is that because there is this gap where the government can't fill and or can't provide those services, then you have this gap that needs to be filled, in the sense that because government contributions as a percentage basis are going down, then that means that the private healthcare insurance and private funded healthcare has to take more of an active role. And so even in a normal inflationary environment, what you will see is that if the benefits don't increase as fast as inflation, then over time, privately funded healthcare will then kick in, and then provide benefits that the government cannot then provide. And so this is a cool chart, because what it shows is that privately funded healthcare goes up over time, and then government funded healthcare goes down. And it doesn't necessarily look like a big decrease, but over time it's a big difference. And so suppose this year, which based on our calculations, the government essentially funds 40% of healthcare. If the government is not able to fully provide what the cost is, then over time it will decrease to a point to where the government is now only funding 25% of healthcare in the year 2049. And likewise, privately funded healthcare will then be 75% of the market, which makes them a higher which makes privately funded healthcare higher bargaining, or they will be able to bargain for better health care, etc., than government. And the government's ability to bargain then decreases over time in a normal inflationary environment. Granted, for my friend, if he's expecting normal inflationary situations like this, a 1 or 2% difference between your benefits increase and the healthcare costs isn't that much. And I would expect something like this. And so if I'm planning to retire in 20, 30 years, I need to expect to cover 20% of my healthcare because the government is not going to be able to do so. Now, in hyperinflationary scenarios, these problems get exacerbated on a shorter time frame. And so if you have, let's say, a hyperinflationary situation where inflation is rising, let's say 100% higher than would have normally been done, and the government tries to make up that gap by providing, let's say, 80% more than what they normally would have, this is what your situation looks like. And so in the span of, let's say, between 2024 and 2035, this is what it looks like. And it's huge, meaning that in 2024, your benefits and inflation are 16,000, but by 2035, your difference is in the millions. I mean, you're talking $20 million. And this is very, very hard to fathom. But in the research we did for the Weimar Republic in the podcast, it's not that difficult to fathom once you understand the compounding power of interest and how hyperinflation is drastically impacting these kind of numbers and the cost of healthcare over time, to where these gaps are almost insurmountable and people have to find alternate ways to get the healthcare that they need. Even if you look less than a 10-year time frame, let's say you look at, let's say, a 5-year time frame, it's still a big gap. And so it's still a big gap. And so if you think, okay, if you think you're going to reach a hyperinflationary scenario, like let's say tomorrow the United States government has a sovereign debt crisis, then in 5 years you can expect your healthcare in differences between what you benefit and the healthcare costs to be a difference of $200,000. In the first 2 years, it's not necessarily that big of a deal. The first year, there's a difference of $3,000. The second year, there's a lot bigger difference in the sense of it's about $10,000. But then that difference expounds over time and it compounds to something that's impossible to grapple with. And hyperinflation is that way. It's difficult to put the genie back in the bottle once you've got that going. The same way with healthcare coverage. And so in a hyperinflationary environment, the coverage that you would have normally received from benefits goes down drastically. And so if you were being covered 100% before hyperinflation, 4 years in, your coverage is 70%. And then if you look at, let's say, 10 years in, your coverage is 50%. And then if you have a situation like Argentina where you have continuing hyperinflation, then the government is providing only 40% of the benefits that would need to have been paid for healthcare. And this is also in line with our research that we found from Argentina, because I read an article from a series of PubMed articles that talked about Argentina and the difference in cost. And so in Argentina, for those who are pensioners or retired, they are receiving benefits from the government in the form of the equivalent of $140 a month. But those $140, they can only afford to pay for prescribed medicine, and that takes up 33% of their pension. And so you have $30 to $50 going to what they need as far as medication, but that then takes up a huge portion of the pension that they receive. And so you can see this in something like this, to where the government is providing 40% of what they need. And so you can see that on top of like normal medications, you have a lot of other healthcare costs, and the government can't even provide those at a level that is acceptable. And so hyperinflation drastically changes people's paradigm, because it not only increases the costs, but the benefits don't increase, and or fixed income doesn't increase at that rate. And that's what this healthcare coverage shows. Another way to look at it is just the cost gap of hyperinflation. And so over time, even though it looks small, over 10 years, it just gets out of control really, really quickly. And sooner or later, something has to happen or something has to give in order for that to come back to normal or whatever. In the Weimar Republic's case, coming back to normal was a very dark road for a lot of reasons that I'm not going to go into. In Zimbabwe's case, it's really ongoing, and many people have opted into more decentralized forms of getting their health care if they can afford it. And in Argentina's case, the jury is still out with Milei and trying to get their hyperinflation regime back in order. But what this also means is that the share of government versus privately funded healthcare also is drastically changing. And so if you have a situation to where you have 100% hyperinflation a year, which really for hyperinflation, it's not that big of a deal. Really, you can have hyperinflation of 1,000% in Argentina's case or whatever, to where what you have is in the beginning, you have the government funding 40 to 60% of healthcare, but in the end of that hyperinflation, the government is hardly contributing 10% of healthcare, and people are opting into privately funded healthcare as best as they can. Granted, even privately funded healthcare isn't enough to meet their needs because you have this rising costs and you have providers that are trying to run faster than the treadmill. And it provides a situation to where many high-skilled physicians and providers go to other countries. So in Zimbabwe's case, many of them in southern Rhodesia, they went to the UK because that's an easy place to go if you're in Rhodesia in the 80s and 90s, which says, well, this is kind of not a good situation. I'm not making as much as I could have in the UK. We're a colony, so I'm just going to go back to the UK and work in London and do a little bit better. And so you have a brain drain on the private side, but still people are opting into private funded healthcare over public because the government just cannot pay for those services. And so I hope this helps you understand the differences in normal inflationary environments and what you can expect for normal inflationary environments. And then if you reach a situation where there's an economic shock, to then be able to adjust your expectations as quick or quicker than what's actually going on. And this will keep you ahead of the curve because then you won't get into situations where you're desperate. And in my reading of the Weimar Republic, at the end of their hyperinflationary regime, there was a high level of desperation on all fronts, and people didn't have in their mind that it was possible 2, 3, 4 years into it until it was very, very difficult to cope with. And so it seems like something that's easy to deal with until it gets to a point to where the cost of things are doubling and tripling every other month, and it's just near impossible to cope with that. I didn't explain or I didn't really emphasize Turkey in this situation, but Turkey also is in a hyperinflationary environment. But from what I hear in Turkey, a lot of what they are doing is opting into using the euro primarily, the US dollar, or gold. And so in that case, because they have access to markets, that's what they're doing. And so even though they're getting paid in Turkish lira, they're that same day exchanging it for the currency that then will hold value over time. So I hope this specific model can help you understand what inflation can do in the short term if you have a normal inflationary environment and in hyperinflationary environment where things are exacerbated on a shorter period of time and your healthcare costs increase dramatically. if you're expecting normal inflationary environment, still it's not wise to expect to get paid 100% of your healthcare costs simply because of this gap between what your benefits are and the cost of healthcare over time. So thanks for watching this specific analysis. If you want access to it, then go to the link below where you will find the full analysis of 13 pages that we have here, and you can explore it yourself, as well as the link to the podcast episode where we explain more in detail the effects of inflation and hyperinflation. So thanks for watching, and I will talk to you later.